I'll start with so how did you choose this career path? Why did you think that becoming a doctor is the right thing?
Well, it was long, long ago. I really didn't join medicine with any altruistic intentions or, oh, I'm going to do a lot of noble service to society. I think at that time we had just two choices. We had a choice between medicine and engineering, and they seemed better. That's all. So I joined medicine, not out of any great, that's what I said, great expectations or great this thing, but I really enjoyed my journey throughout. Yes.
Wow, that is great. So what is your background? Like, where have you done your 11th and 12th? Which board?
So for all you girls who think that you really need to do 11th and 12th from the so-called elite colleges, I did 11th and 12th in a small school called the Hindustan Organic Chemicals High School in a small place called Rasayani, which is much beyond Panvel. Yeah.
Oh, okay.
So, and I got into GS Medical College. If you all are from Mumbai, you should know that GS is one of the best medical colleges to get admission into. I did my undergraduation and post-graduation both from there. I did my post-graduation in obstetrics and gynecology, and then got a couple of fellowships going abroad. But the reason I'm telling you all this is not to boast, but the reason I'm telling you all this is that it's not difficult for anyone to get in if you set your heart on it. Yeah.
Of course, ma'am, of course. So how do you see this industry changing in the next few years?
What I see is that small nursing homes are soon going to be a thing of the past. It's all going to be big corporate hospitals. And if you're talking particularly about my field, obstetrics and gynecology, there's going to be a lot of super specializations coming in. Already you have super specializations like IVF. I don't know if you know what is IVF. It's test tube baby and infertility.
Yes.
That's a very niche subspecialty. Or you have something called as fetal medicine, where the doctor will only deal with pregnant women where they are high risk, the baby is at risk, and they will try and ensure that both the mother and the baby have a safe 9 months. So subspecialties in gynac are going to be things like gynac oncosurgery or gynac pelvic surgery. Onco means cancer, so specializing only in gynac cancer is again a subspecialty that is fast coming up. Or if you're a young girl, you must have heard the word PCOD being thrown about right, left, and center. So that part is called gynac endocrinology. That's also a specialty that's coming up. So, yeah.
And what do you enjoy the most about your job?
The satisfaction on a mother's face.
All right. And as you already mentioned, like the numerous ways that it's changing, is there anything else you'd like to add on to in the face of job opportunities in this career?
In terms of job opportunities, I don't think it's all that difficult. Yes, it is arduous journey. You're going to study for a long, long time. But today, even in engineering, you wait, you do work X, then you get your MBA. So 10 to 12 years of study is there in every field. And fortunately, OBGY is one profession which is recession proof. Okay, we're always going to produce babies.
Of course.
So from that point of view, job recession, I don't think is difficult. But there's a lot of competition, and it is very easy to get swayed and become unethical. So you need to keep your head on your shoulders and decide what you want to do or what limits you want to cross. Yeah.
Of course. And you mentioned PCOD. So even in our, like, especially our age, like there'll be so many girls that I know that have PCOD that are going through it, but then it also like goes away. In the sense it's not a permanent thing. So how does that work?
Yes, but PCOD doesn't go away. It's always kept in control. PCOD is a hormonal imbalance that you have in your body. okay? And that imbalance needs to be brought back. The skewer in the balance needs to be brought back to normal. So that's what you do with PCOD. Yeah.
Okay, and is there any particular reason why girls of our age tend to get PCOD?
Because you are very stressed out. You'll eat a lot of junk. You'll sleep at irregular hours, and you'll hardly exercise.
Wow, you just named everything. This is literally what we guys do. And
So if you go easy on the pizzas and the burgers and the McDonald's and the Domino's, yes.
of course. And is there any last piece of advice you would like to give us before I open the floor to questions from the visitors?
No, my only advice would be that there is no shortcut. Hard work is a must, irrespective of what field you want to do. Whether you want to become a singer, a dancer, a fashion designer, hard work has to be done if you want to be successful. And if you're looking at OBGYN, you're going to face emergencies. So you're going to have a lot of sleepless nights. The post-graduation is difficult. But it's all worth it when you see that mother smiling with her baby.
Wow, that is great. Okay, so I'll be opening the floor to questions. You can either unmute yourself and ask a question directly, or you can type it out in the chat box. We'll be waiting for 10 seconds for questions.
I would prefer if you ask me, because unfortunately my screen is not okay. Either way, will do.
Okay, and even if you can't see it, I can read it out.
Yeah, I know I can. I was just making a mistake somewhere.
All right.
No questions. Everybody is set to become a doctor and has absolutely no doubts.
I think we just need to give them 5 more seconds. They're probably typing it.
Sure. If you're looking to study medicine abroad, I would say the UK. The degree that you get from UK is recognized all over the world, whether it's the US, whether it's Australia, whether it's New Zealand. So if you're looking abroad, definitely UK. Though many people today are studying in China, Russia, Czechoslovakia, and Philippines.
Good evening, ma'am.
Yes.
I am currently preparing for my NEET exam. So, according to you, which is more valid, to go abroad after MBBS or after giving, the 12th boards?
I would say after MBBS. I would say after MBBS, because MBBS in India, the kind of clinical work that you see, in fact, I would also recommend you do your post-graduation in India and then go abroad and get a few really good fellowships, unless you want to settle abroad. If you want to practice medicine in India, then I would say do your undergrad, postgrad here, because the volume of clinical material that India has, no other country has. And it prepares you for any emergency, any eventuality. So that would be my recommendation.
Thank you, ma'am.
All right, just the last 5 seconds if anyone has a question.
Radha, the confidence comes, okay? That's what I was just explaining some time ago. Today, in every field, you have to put in 8 to 10 years of hard work before becoming successful. Yes, to become a doctor, the study is longer, but as you do it, you will start enjoying it, because here you're interacting with humans. When you treat, say, a fever in a baby and the baby becomes okay, the gratitude that the mother shows, or you have treated a person with a fracture and he heals and he walks, The kind of satisfaction you get in that, you will not get in any other field. So as you start doing medicine, the confidence automatically comes. And for the other girl who asked me, can I stay motivated? I would say definitely. Karen, you will definitely be motivated once you start pursuing this career. So much time is there in everything. For Priyal, it all depends on the mental makeup you have. If you're a person who feels that I do not want to be answerable to anybody, I would definitely work in a clinic of my own. But small clinics are going to soon not be able to stand on their own, is what I feel. So big hospitals are the future. Getting sex education is extremely, extremely important. Karen, today we don't call it sex education, we call it sexuality education. If you'll want a session on that, I'll be more than willing to help at some time. All your doubts, you'll need to get it cleared instead of having misconceptions and then suffering. Yes.
There's one more question, ma'am.
Okay. Well, the high paying fields today, if you see with least amount of stress, is one is radiology, which is sonography, x-ray. It's high tech, doesn't involve too much of emergency, definitely high paying. Another high paying field is ophthalmology, again high tech, and you don't have too much of emergencies. So I would say these two are good high paying fields. Of course, you have the routine cardiology, neurosurgery, not so great. But radiology and ophthal, way to go today.
All right. Okay, we'll wait for 5 more seconds for more questions.
Don't feel shy, girls. Ask whatever you want to. It doesn't matter. No question is silly. You know, probably the other girl also wanted to ask it. A surgeon in India in big cities will get paid after he super specializes anywhere between 2 to 3 lakhs a month. By the time he crosses the age of 45, it should be around 4 to 5 lakhs a month. But if you're in smaller towns, you get paid a lot less. Yes. I mean, you can't compare your salaries with the MBAs or the guys in finance. You can't compare your salaries with that. No.
Ma'am, how are you handling your appointments in COVID-19?
So what we do is we are definitely encouraging a lot of teleconsultation. And then the ones we cannot work on teleconsultation, we space out the appointments, and we are seeing a lot less of patients personally. But my field is such that I have to attend emergencies. So we wear those PPEs and then we deliver the mothers or operate on them. Yeah, they're like hazmat suits.
Oh, all right.
I mean, you start sweating within 15 minutes of wearing them.
Of course, yes. All right.
Ma'am,
Yes.
when you were pursuing your MBBS, did that time itself knew that you wanted to do gynae, or you were open to other
Yes.
fields as well?
Yes. I knew I wanted to do gynecology because I did not like general medicine. I hated ECGs. Okay. And I enjoyed the field of obstetrics and gynecology. I enjoyed the feeling when a baby is born, seeing the smile on the mother's face, the feeling of satisfaction that you get. Yes. But it is okay if you don't know till the end, and you can decide, because today it is NEET PG, you can even decide after giving your NEET PG.
Because even I want to pursue either gynecology or oncology. So I'm not really decided yet, but maybe after MBBS, after everything is exposed, maybe then.
Yes. Because once you've been through the entire 4.5 years, things become a lot clearer and you'll know where your heart lies.
Yes, ma'am. Ma'am, are you aware of any current controversies in the area of medical ethics?
There are lots, but I don't want to get into it. Yeah.
All right. Okay.
You can write pages on it, and medical ethics. That's what I said, that you need to set the boundaries for yourself. Because once you start slipping, it's a very, very slippery slope.
Of course. And has your gender ever impacted your decision to pursue a medical career?
Personally, me, no. I did gynac because I want to, but definitely many women are told by their families that don't do surgery because it is, for males. It is not a good career for women. Don't do neurosurgery. Don't do heart surgery. But we have amazing women surgeons, right, from pediatric cardiosurgeons. Okay, so they only operate on babies' hearts, and neurosurgeons. Yes. So today, I don't think gender should be an obstacle for pursuing what you want. No.
Of course. Okay, just last 5 seconds. Okay, someone just asked a question.
Yes, menstrual cups are good. They are safe. But menstrual cups for young girls, when you are virgins, you're not in sexual relationships, is a very uncomfortable thing to use. So I would recommend it after you are married or you are in a stable sexual relationship.
All right.
And if later on, Himanshi, you want me to come back and do a session on the girls' doubts regarding sex, menstruation, PCOD, I do a lot of this counseling, I'll be more than happy to come back.
All right, ma'am. I will try to make a group, collect a few girls, and get that into action.
So that doesn't have to be a specific STEM related. It's a general health
Yes. Yeah, just a doubt
related
session.
talk. So whoever wants to join in can join in, because I feel a lot of young women have a lot of misconceptions and a lot of doubts which they don't get cleared properly from the internet or Google, so, or they get incorrect information from their friends, because these are the two main sources from you get your information on sex, right?
Exactly.
So are we done?
I guess so. Probably just wait for another 2 seconds or 3 seconds if anyone's going to type a question.
Okay. So I just want to say thank you. Thank you,
Thank you
Himanshi, for
so
inviting
much.
me. It was a pleasure. And if you'll need me for any health related things, more than happy to help at any time.